Hello everyone. Today's topic is about nipple pain. Okay, why do I have sore nipples? That may be the question, or why my nipples are paining so much. Okay, depending on the individual, reason for nipple pain also varies. Okay, in today's video, we will discuss about what are the different reason for nipple pain and when is it normal and when it is not normal and when to meet a doctor. Okay, before going forward, understand one thing that there are so many factors which decide the reason for your painful nipples. Means when exactly your nipples are painful, means what particular days, means in your menstrual cycle, whether you have sore nipples after ovulation or before ovulation, or during early pregnancy or before trying for pregnancy, or in second trimester or in the third trimester or after delivery, that is post pregnancy, or we can put it in this way as painful nipples in a fertile age, or painful nipples in infertile age, that also. Okay, so that's so altogether we can say there are so many factors which decide the reason for nipple pain. Okay, in this video we will discuss about different reasons for your painful nipples along with the factors, or means when it is happening, depending on how when it is happening, we can discuss the reason so that it will be more precise to understand, so that you can find out your reason for nipple pain. Okay, let's go then. First one is a fertile age. In fertile age, if you are getting nipple pain, means most of the time it is because of a hormonal variations, and more specifically it is because of progesterone variation. Okay, so you are getting nipple pain in your fertile age, means you may be ovulating. Okay, so it can be considered as a ovulation symptom also. And the second one is when you are about to get your period, so that it can be considered as a premenstrual symptom within few days. If you are due by 4 or 5 days, now you are getting your nipple pain, means it means that you are about to have your period, so that it may indicate your ovulation, or it may indicate, or it may tell you that your periods is on the way. Okay, and most of the time it may be because of if you are consuming any medicine or supplement which has a progesterone in it, then also you may get nipple pain. And sometimes if you have implant in your arm, I think those who are planning, they will know about implant. That is a temporary or short term contraceptive method. So if you have a implant in your arm, then also your nipples may pain. And sometimes if you have a IUD, means intrauterine device in your uterus like Mirena, then also your nipples may pain. And most of the time it may be because of the stress also. Okay, in fertile age, if you are getting nipple pain, means these are the possible reasons for your nipple pain. Next one is infertile age. If you are getting nipple pain in your menopausal age, means most of the time it is because of the estrogen deficiency. Okay, as age increases, your estrogen levels goes down. So because of that also, most of the women in menopausal age get nipple pain. Next one is early pregnancy and pregnancy. In during pregnancy, body goes through different changes to prepare itself for feeding, post pregnancy feeding, so that there will be an increased blood flow to breast tissues, so resulting in changes in shape of the breast, size of the breast, increased areola, thicker areola, and increased in size of nipples and shape of nipples. In the same way, sore nipples are also part of whole body changes in which body prepares itself for post pregnancy, where we have to feed our baby. Okay, so having sore nipples is common during pregnancy and early pregnancy. During post pregnancy, if you are getting nipple pain, means post pregnancy, that is after delivery, if you are getting nipple pain, means it may be, most of the time it will be because of improper positioning of a baby while feeding them. Okay, so that what happens, because of improper way, babies will suck only the nipples, so that you will get nipple pain, because that time you have to feed your baby every 2 hours. Okay, so that 2 hours, 2 hours, 2 hours, 2 hours, so that because of that you will be getting nipple pain, as your baby is sucking only the nipple. That complete areola part should go inside baby's mouth, so that you will feel comfortable and baby will suck properly. That is the exact proper way of feeding babies. Okay, this is one. As after delivery, that is post pregnancy, after delivery, if you are getting nipple pain, means this is the major reason, that is improper positioning of baby. If that is correct, the second one is, second one may be because of, if you are pumping your breast milk to feed your baby, that may be because of so much of pressure, if you are using manual pumping machine. Okay, or if you are using nipple shields, nipple shield, most of the people will know about nipple shield. Nipple shield are those things, silicone nipples, which mothers use, so that babies can suck milk properly. Okay, some of the people, some of the women will have small nipples, for them these nipple shields will be useful. And if at all you are using nipple shield and if it is not fitting you properly, or maybe because of so much of pressure, then also it may be painful. So nipples in post pregnancy is common because of pumping milk and usage of improper usage of nipple shields. And the next one is when your hormones are coming back to normal, means weaning. Okay, weaning is the part where you are completely you are introducing solids to your baby, so that at that time you will be stopping your breast milk, so that what happens in your body, all hormones will come back to normal level, that is pre-pregnancy level, they will come back. Okay, in this transition also there is a chance of getting nipple pain. These are the most common reasons in which women will have sore nipples. Okay, other than this, also so many other reasons are there where it is not related to your fertility. Okay, in that, the first thing is when you are consuming any medicine on daily basis which is related to your mental health or the heart disease. If you are taking medicine related to heart disease and your mental health, then also in some of the days you may get nipple pain. Next reason is trauma. This trauma may be because of rough foreplay during intercourse, or it may be because of any accidental pressure. And the next reason is because of improper innerways which you are using continuously for so many days. Next reason is any sort of infection to your breast tissues may cause sore nipples. Next reason is shaving around nipples. Next reason is allergy because of washing powder, soap, or detergents. Next reason is sometimes it may point towards um, breast cancer, but if at all it is because of breast cancer, along with sore nipples, you will definitely have some other symptoms which are so severe. At that time, you have to visit doctor. Next question is when it is normal and when it is not normal, and when you have to consult a doctor. Most of the time, painful nipples or a sore nipples will indicate ovulation or your upcoming period, so that it will be there for only few number of days, a specific number of days or specific days of your menstrual cycle. It means when you are about to ovulate or after ovulation. So those days around your ovulation, if you have painful nipples, means it is normal. Okay, When you have upcoming period, means when you are about to get your period, that is 4 or 5 days before your period, that is a premenstrual symptom. So at that time, if you have nipple pain only for those 4 5 days, after that you will get your period, and then that's it, boom. After that there will be no painful nipples. If this is the case, it means when you have only for painful nipples only for few days of your menstrual cycle, then it is completely normal. When it is coming on its own and going back on its own, you are not at all doing anything, means it is completely normal, no need to worry. Okay. When it is persistent, painful nipples or sore nipples are persistent for so many days and it is not at all going on its own, means it is a problem. At that time you have to consult a doctor. Okay, this is one. Next is when only one nipple is paining and when another nipple is not at all painful, at that time you have to meet doctor. When you have um, irrelevant discharge from your breast, and when it is not breast milk, when you are not deliver you have not delivered baby and you are not conceived, when you are not in third trimester, then also you find, if you find strange discharge from your breast, then it is a call when you have to go to doctor. And the next thing is when you have sore nipples along with the red rashes around your breast tissues, and along with that if you have a fever, if you have fatigue, and along with that if you have if you can feel lumps in your breast, then you have to meet doctor. So now comes the conclusion. Most of the time, painful nipples or sore nipples are common, and it is because of a variation in hormones. That is, most of the time, it is because of the progesterone hormone variation. When the sore nipples are so persistent and it's not going on its own, and it is there for so many days, and you are feeling very uncomfortable and intolerant, when the obviously pain tolerance depends on individual and it differs from individual to individual, then also when you are not able to take these things more, okay, no, I can't handle it more now, when you reach this stage, please consult doctor. Okay, most of the time because of the ovulation or because of the PMS you may get sore nipples. Other than that, and pregnancy, post pregnancy, means that is after delivery also, there are so many reasons which we have discussed already. Those are normal reasons for them. For that reasons also you have to consult doctors. Okay, if at all it is okay, if it is tolerable and it is there for only few days, for a week and all, then it is okay. If it is more than a week and it is intolerable, please visit doctor. Okay, and if you have any doubts about sore nipples, please comment below and I will try to answer all those questions. And if you find it useful, please like, share and subscribe my channel.